Hi guys, today we're going to be talking about vitamin D deficiency. And as we all know that vitamin D falls under the category of fat-soluble vitamins together with vitamin A, E, and K. But today our main focus is going to be vitamin D. So we're going to touch on a few important topics on how vitamin D deficiency comes about and how it affects different parts of our bodies. Then later we'll briefly talk about its treatment. So to begin with, we'll discuss on how absorption and metabolism play a monumental role in vitamin D deficiency. Moving on to the slide, as we see absorption and metabolism affected by fat malabsorption. I think it's common knowledge that vitamin D is a fat-soluble vitamin, as I said earlier on, and that means fat plays a major role in its absorption. So if there's a problem in the fat metabolism or absorption, that will definitely affect vitamin D absorption. So that will lead to vitamin D deficiency. So the first point goes pancreatic insufficiency. As we all know, the pancreas releases certain enzymes, that play a role in fat metabolism. So if there is an insufficiency or a deficiency in these enzymes, that will lead to vitamin D deficiency. All right, the next point is cystic fibrosis. Then we have cholestatic liver disease, celiac disease, Crohn's disease. In all these diseases, fat absorption is affected, and that will affect the absorption of vitamin D also. All right, moving on to the next slide. 1.25 OH vitamin D effects. The first point goes, it increases calcium absorption in the gut. Number 2, it increases PTH-mediated bone resorption, and this is due to the activity of osteoclasts. Number 3, it increases bone calcification, and this point is very important because without it, the victim will develop rickets if it's a child and osteomalacia in adults. Then number 4, it decreases renal calcium and phosphorus excretion. Number 5, decreases PTH secretion. All right, next slide. All right, so these are the consequences of vitamin D deficiency. Reduced intestinal absorption of calcium and phosphorus. Hypophosphatemia precedes hypocalcemia. Secondary hyperparathyroidism. Bone demineralization, osteomalacia / rickets. Sources of vitamin D. This is also the treatment for vitamin D deficiency. The first point is exposure to sunlight. Ultraviolet rays play an essential role in the activation of cholecalciferol or vitamin D. So exposure to sunlight is a solution if the cause is due to lack of sunlight. So yeah. Then the next point is dietary sources. We have fish, milk, etc. These can cure the disease if the deficiency is due to dietary reasons. Then the last point is supplements. There's some vitamin D supplements that the patient can take that can be very useful in treating the disease. So basically that's it, and I hope you enjoyed the video. I hope to see you next time. Bye.